Coronavirus disease 2019, COVID-19. How coronavirus spreads. COVID-19 is a new disease and we are still learning how it spreads, the severity of illness it causes, and to what extent it may spread in the United States. Person-to-person spread. The virus is thought to spread mainly from person to person. Between people who are in close contact with one another, within about 6 feet. Through respiratory droplets produced when an infected person coughs or sneezes. These droplets can land in the mouths or noses of people who are nearby or possibly be inhaled into the lungs. Can someone spread the virus without being sick? People are thought to be most contagious when they are most symptomatic, the sickest. Some spread might be possible before people show symptoms. There have been reports of this occurring with this new coronavirus, but this is not thought to be the main way the virus spreads. Spread from contact with contaminated surfaces or objects. It may be possible that a person can get COVID-19 by touching a surface or object that has the virus on it and then touching their own mouth, nose, or possibly their eyes, but this is not thought to be the main way the virus spreads. How easily the virus spreads. How easily a virus spreads from person to person can vary. Some viruses are highly contagious, spread easily, like measles, while other viruses do not spread as easily. Another factor is whether the spread is sustained, spreading continually without stopping. The virus that causes COVID-19 seems to be spreading easily and sustainably in the community spread, in some affected geographic areas. Community spread means people have been infected with the virus in an area, including some who are not sure how or where they became infected. Situation in U.S. Different parts of the country are seeing different levels of COVID-19 activity. The United States nationally is in the initiation phase of the pandemic. States in which community spread is occurring are in the acceleration phase. The duration and severity of each pandemic phase can vary depending on the characteristics of the virus and the public health response. CDC and state and local public health laboratories are testing for the virus that causes COVID-19. View CDC's public health laboratory testing map. All 50 states have reported cases of COVID-19 to CDC. U.S. COVID-19 cases include imported cases in travelers' cases among close contacts of a known case, community-acquired cases where the source of the infection is unknown. 27 U.S. states are reporting some community spread of COVID-19. View latest case counts, deaths, and a map of states with reported cases. Cases in U.S. This page will be updated regularly at noon Mondays through Fridays. Numbers close out at 4 p.m. the day before reporting. CDC is responding to an outbreak of respiratory illness caused by a novel, new, coronavirus. The outbreak first started in Wuhan, China, but cases have been identified in a growing number of other locations internationally, including the United States. In addition to CDC, many public health laboratories are now testing for the virus that causes COVID-19. COVID-19, U.S. at a glance *. Total cases, 44,183. Total deaths, 544. Jurisdictions reporting cases, 54, 50 states, District of Columbia, Puerto Rico, Guam, and U.S. Virgin Islands. Asterisk data include both confirmed and presumptive positive cases of COVID-19 reported to CDC or tested at CDC since January 21, 2020, with the exception of testing results for persons repatriated to the United States from Wuhan, China and Japan. State and local public health departments are now testing and publicly reporting their cases. In the event of a discrepancy between CDC cases and cases reported by state and local public health officials, data reported by states should be considered the most up-to-date. Cases of COVID-19 reported in the U.S. by source of exposure * cases of COVID-19 reported in the U.S. by source of exposure travel-related 479 close contact 569 under investigation 43,135 total cases 44,183. Data include both confirmed and presumptive positive cases of COVID-19 reported to CDC or tested at CDC since January 21, 2020, with the exception of testing results for persons repatriated to the United States from Wuhan, China and Japan. State and local public health departments are now testing and publicly reporting their cases. In the event of a discrepancy between CDC cases and cases reported by state and local public health officials, data reported by states should be considered the most up-to-date. CDC is no longer reporting the number of persons under investigation (PUI) that have been tested, as well as PUI that have tested negative. Now that states are testing and reporting their own results, CDC's numbers are not representative of all testing being done nationwide. Travelers returning from high-risk countries. Depending on your travel history, you will be asked to stay home for a period of 14 days from the time you left an area with widespread or ongoing community spread, Level 3 Travel Health Notice. Countries that have a Level 3 Travel Health Notice, widespread, ongoing transmission. Australia, Brazil, Canada, Chile, Ecuador, India, Indonesia, China. Europe, Schengen area, Austria, Belgium, Czech Republic, Denmark, Estonia, Finland, France, Germany, Greece, Hungary, Iceland, Italy, Latvia, Liechtenstein, Lithuania, Luxembourg, Malta, Netherlands, Norway, Poland, Portugal, Slovakia, Slovenia, Spain, Sweden, Switzerland, Monaco, San Marino, Vatican City, Iran, Ireland, Israel, Japan, Malaysia, Pakistan, Philippines, Qatar, Romania, Saudi Arabia, Singapore, South Africa, South Korea, Thailand, Turkey. United Kingdom, England, Scotland, Wales, and Northern Ireland. COVID-19 Health Alert, Coronavirus Disease 2019, COVID-19. You have traveled to a country with an outbreak of COVID-19 and are at higher risk. Download PDF version PDF icon. Stay home for 14 days from the time you left an area with widespread, ongoing community spread, Level 3 Travel Health Notice countries, and practice social distancing. Take these steps to monitor your health and practice social distancing. Take your temperature with a thermometer 2 times a day and monitor for fever. Also watch for cough or trouble breathing. Stay home and avoid contact with others. Do not go to work or school for this 14-day period. Discuss your work situation with your employer before returning to work. Do not take public transportation, taxis, or ride shares during the time you are practicing social distancing. Avoid crowded places such as shopping centers and movie theaters and limit your activities in public. Keep your distance from others, about 6 feet or 2 meters. What to do if you get sick? If you get sick with fever, cough, or have trouble breathing, seek medical care. Call ahead before you go to a doctor's office or emergency room. Tell your doctor about your recent travel and your symptoms. Avoid contact with others. If you need to seek medical care for other reasons, such as dialysis, call ahead to your doctor and tell them about your recent travel to an area with widespread or ongoing community spread of COVID-19.